Hello and welcome to The Real USA. Today we're in downtown Washington, D.C. We thank you for your interest in the program and in these stories brought to you from the United States and told in a way that only teleSUR could do. I'm Alexandra Hall. As you watch the program, I invite you to share your comments and suggestions via our Twitter at teleSUR English. Downtown Brooklyn is home to a large community of Africans who have limited access to public health care. But recently, a group banded together to help those who need medical attention but who don't have health insurance. Our correspondent Mimi Chiaman has the story.
A neighborhood mainstay, Nelson's Barbershop has been on this block for 25 years. And 15 years ago, despite being in the business of haircuts, owner Nelson Uraka started talking to his customers about their health. He works with the Arthur Ashe Institute, an organization committed to helping immigrants and low-income families. By asking questions of his customers, Nelson hopes to highlight the health issues that disproportionately affect black men.
There are issues that we have in this neighborhood, and because of lack of health care, we don't go and seek it.
He's talking specifically about prostate cancer and HIV, both sensitive issues, but the safe space allows for open conversation.
It is intimate. You came here for a specific reason, so you're not nervous, you're not, you know what I mean? It can lead to something way bigger than what you came for. So I do know that the space is intimate. I know that the space is relaxed, and you know, I can guide you to your next step just by being here.
Socioeconomic disadvantages make access to healthcare a challenge in this community. The disparity is glaring, and some say policy and clinical trials leave much to be desired. Where they fall short, grassroots initiatives have stepped in to bridge the gap.
We wanted to make sure that we can improve access to health in addressing some of those social determinants of health and making sure that people receive better health care so that health outcomes could be improved.
According to the Center for Disease Control, residents in central Brooklyn have some of the highest mortality rates compared to other residents in New York City. But for many, visits to the barber are more regular than visits to the doctor.
The truth is, if you're going to have programs that are hospital-based or clinic-based, you're going to miss out on a big part of this population because a lot of the folks don't have health insurance, so a lot of them will not be at the hospitals or the clinics. One of Arthur's famous quotes is, "Start where you are, use what you have to do what you can." So we go where they are to be able to use what we have in the community and to be able to bring change.
But there's only so much the Institute can do on its own. Instrumental changes need to come from above.
Starting with your local legislators, the state level, and even nationally, that we can inform. If we can inform policy and can subsequently help to change policies to improve health outcomes, I think that would be effective.
More jobs will mean you have options to eat better food. You know, more jobs will mean you may have more time to exercise. So I think economics is a big part of something that will bring change.
It could be some time before Central Brooklyn sees such changes, but in the meanwhile, over 300 local businesses and organizations are doing their part to advocate for better health. Mimi Chiaman for teleSUR, New York.
Let's keep going with public health. When it comes to maternity benefits, the United States ranks at the bottom compared to other developed countries. Many young mothers don't have health insurance, and they're often forced to return to work just a few months after they give birth. Our correspondent Mary McCarthy has this report.
Yeah. Rosie Shank says she loves being a mother to 4-month-old Cruz. She works as a public health specialist, but even with her medical knowledge, she says that when she returned home after giving birth, she was completely overwhelmed.
You know, I have a hard time asking for help. How do I navigate? What are some tools I can use? You know, I haven't slept in a long time. I'm not thinking rationally. Can you just tell me that this is okay and that this is temporary and that this will pass? In the beginning, you know, he cried so much and he was so needy. I had to keep him constantly on me.
Rosie was recovering from a cesarean section that left her weak and unable to care for herself.
Someone to help me navigate the shower. I didn't realize how slippery my shower was until I got in there after a C-section. And, you know, just helpful things like that. My husband went to work right away. My mom was here and caring for me, but once mom left, you know, I would wait to take a shower until my husband got home because I was terrified of falling.
American women typically spend at most 2 days in the hospital after giving birth, and many of them return home to a precarious situation since the U.S. is the only developed nation without paid maternity leave. American women we spoke to said they needed not just greater financial support during and after pregnancy, but also greater emotional and logistical support. Tara Hoffman says she experienced an unexpectedly difficult birth, after which she needed to hire at-home assistants.
Unfortunately, they are $35 to $40 an hour, and we had them come for between 4 and 8 hours a week in order to just get me some sleep. Really, that's what it is for me to be able to heal. Even with that, I was a wreck.
Exorbitant costs for at-home care, no guarantee of paid maternity leave. Even educated middle-class mothers like Tara and Rosie say they weren't prepared for just how hard the first few months at home with baby were going to be.
I think even just a helpline where a mom could call and ask questions, whether it's with her care or her baby's care. But I mean, there were times where, is this normal? And I'd have to resort to the internet. And anytime you do that, you get scared out of your mind because you see the worst situations, of course, that are posted all over the internet. And so just some sort of reassuring, yes, this is normal. You know, you could call in, you could speak to a health professional and get your questions answered.
Good job.
Rosie says that despite the challenges, she knows she's lucky to have paid time off to spend with her baby. According to the Institute for Women's Policy Research, professional women like her are much more likely to have paid leave than low-income mothers.
All right.
Mary McCarthy for teleSUR, Denver.
You feel that cool air? Child poverty rates are surprisingly high in the United States for a wealthy industrialized country. According to a recent report by UNICEF, around 1 in 11 children in this country is currently experiencing poverty. William Denzo has the story in North Carolina.
Never in my wildest dreams. I never thought I would ever be homeless.
Donna was recently evicted from her apartment after a minor dispute with the landlord. She's the age of a grandmother, but busy raising a niece and nephew, and the three of them suddenly no longer had a home.
Always worried about the kids. You know, we can't do this because of the kids. I can't do, you know, so my kids were always number one.
Nationwide studies show their case is far from rare.
In Metro Denver, from some of the studies, families are the majority of the homeless population, which often is shocking to many people because you don't always see families out on the streets. You might see individuals, you might have a male stereotype, but you don't always see, you know, a mom and 2 kids walking around or panhandling or anything like that.
Even in a region with one of the strongest economies in the U.S., the effects of the 2008 financial downturn and mortgage crisis are still being felt, with homeless shelters in the Denver area full to capacity.
The top reasons in Metro Denver for homelessness are job loss and home loss. And the third reason is actually a family breakup. So it can be an illness, it can be a death, it can be a divorce, things like that. And a lot of times what families experience are a cycle of different things. So maybe one thing happens, leads to another thing, and then they can't get out of that cycle.
Donna, 12-year-old Kilea, and 10-year-old Bernard bounced from one hotel to another, and after a few months got a place in this transitional housing shelter. Here they share a single room and have access to the in-house cafeteria and this entertainment area for children.
When we got here, all we had was the clothes on our back.
Kilea and Bernard say living in hotels was hard.
Because there really wasn't a way for us to get to school.
Now they still have a long bus journey to school, but overall they like living here.
The food is good sometimes. Most of the time, no. that I made a lot of friends.
I got to make new friends.
Experts say that homelessness can have a traumatic effect on young people.
A lot of times they have to grow up too fast. There are situations they have to go through that maybe not everyday kids have to go through, like sleeping in a car, sleeping in motels, taking care of younger siblings.
Donna hopes that within the next year she'll get into low-income housing and the kids can get the stability and space they desperately need.
I'd just like to move from here into low-income housing somewhere. You know, it'd be nice to be in our own place again, you know, where the kids can have their own bedroom.
In 2010, the U.S. federal government announced a program aiming to eradicate child and family homelessness by 2020. But with the number of young people without stable housing on the rise, that goal seems further and further out of reach. Mary McCarthy for teleSUR, Denver.
Lawmakers in North Carolina have taken action to restrict child labor on tobacco plantations, steps that human rights groups say are necessary for protecting the health and well-being of underage workers. William Denzo spoke with one miner about what it's like to be a kid working in the tobacco fields of the United States.
Anna Yesenia Flores has been working on tobacco farms since she was about 12 years old, sometimes working 7 days a week to help support her mum after her divorce. Now 17, she hopes to be the first one in the family to make it to college. But those memories from the fields are hard to forget.
The tobacco plants are like 6 feet tall, and you have kids like me that are 4'9" trying to reach those plants. You get very tired from your shoulders and your back, and sometimes you get chemicals sprayed on you. Like, I'm pretty sure that's not supposed to happen.
Anna is not alone. Under US laws, if there's parental permission, then children as young as 12 can work on farms so long as it's out of school hours. The result, according to some human rights groups, is that there are children that have been exposed to pesticides and have shown symptoms of acute nicotine poisoning. And with North Carolina being one of 4 states that accounts for 90% of tobacco grown in the US, the problem is especially relevant.
There's a real threat, you know, to the well-being of these kids. It's different than, like, you know, if you're picking cucumbers, which, yeah, it's long, hard work, you know, long, hard days, it's hot, it's hard work. But, like, it's a whole nother ballgame when you're dealing with tobacco.
And here in North Carolina, it's an issue many hope is beginning to be addressed. In October, the Tobacco Growers Association of North Carolina issued a policy saying that children under 16 shouldn't be hired to work in tobacco farms, even with parental consent. And representing over 2,300 tobacco farmers, they say they don't condone child labour. Graham Boyd works for the Tobacco Growers Association of North Carolina. While he says there could be some cases of child labour, the issue has been greatly exaggerated.
The scale is our primary response. It just isn't widespread. It isn't an epidemic problem. As I've said repeatedly now, it overwhelmingly does not exist. There are many operations that we could go to today where there aren't any persons in the field. It's all done completely by machine harvest.
It's winter now, but when it's time for tobacco harvesting in a few months, children under 16 should not be seen in fields like these. But with these tobacco workers so reliant on the whole family earning money, making ends meet remains a huge area of concern.
They wanted to make sure that they had, that income would be replaced in some way. And like I say, you know, the greatest way to solve that would be to pay the parents more.
It's a notion some reject. The Growers Association argue it will make families more inclined to put their kids into the fields to make even more money. But for Anna, she says it will make a world of difference. But she wants to see these companies do more than pay their workers a decent wage. She wants them to introduce schemes like scholarships so people like her can make a real difference for their families, starting with a full education. William Denslow, teleSUR in North Carolina.
Currently, there are more than 21 million veterans living in the United States, and they often face serious issues like illness, poverty, and suicide. Now many are asking for more support from the government.
John, veterano de Vietnam, padece de terribles dolores. Tiene artritis y asegura que una cirugía en el hospital para veteranos empeoró su condición.
I would fight for my country. I love my country. I would do it all over again. But I would have stuck with private insurance. I don't think I would have come to the VA. My son is a veteran. He feels the same way. He has shoulder problems, and he's been waiting 6 months to see a doctor.
Alrededor de 1,5 millones de veteranos viven por debajo del umbral de la pobreza y tienen una tasa de desempleo que casi duplica al promedio estadounidense.
I don't really need a lot of economical support because I had a career after the Navy, but I know there's people who do, but there's still, there's all kinds of things out here for veterans. They just have to look into them.
En los Estados Unidos, una de cada 5 personas sin techo es un veterano. Benson, quien pasó por esa situación, espera mayor apoyo desde el Estado.
I think it's sad if a veteran is homeless. I think it's sad that a veteran doesn't have proper assistance for food and shelter to help their families after serving their country. I think that is very sad. But I also feel as though if there's a way that they can get help, I think that our country should give it.
Cada 65 minutos, un veterano de guerra en Estados Unidos se quita la vida.
Certainty what the exact statistic is. It's about 22 is what the statistics have been put at. If you look at different groups of veterans, though, there's some different trends. One of the things the VA has said is that for older veterans, the trend is that suicides are decreasing. Unfortunately, for younger veterans, the trends are that suicides are increasing.
Ante esta realidad, este martes el Senado aprobó una ley para prevenir los suicidios de veteranos, brindándoles mayor apoyo psicológico. La normativa se llama Clay Hunt, en memoria del joven soldado que sirvió en Irak y se quitó la vida en 2011. Francesca Emanuele, Washington DC, teleSUR.
Every year, the Department of Veterans Affairs, or VA, gives veterans millions of dollars in the form of pensions and injury compensation depending on how long they served. But sometimes veterans are asked to give back some of that money that the VA says was overpaid.
I was in the Air Force from 72 through 78. I served in SAC and in NORAD.
Tom McNerney has been receiving Department of Veterans Affairs, or VA, pension benefits since 2010, when he lost his job. But he recently received this letter, saying the VA has been overpaying him and they want their money back.
Almost $37,000. It'll wipe me out.
Tom readily admits he made a mistake. He didn't know vets must declare all their sources of income to the VA each year. Declaring their income to the IRS, as Tom was doing, is not enough.
I filled out paperwork as honestly and honorably as I could, and the flow of paperwork claiming that I didn't give them complete or truthful information has been a little insulting and horribly confusing.
When he first received the overpayment notice in June, Tom said he was in shock. Eventually, he turned to these other veterans for advice.
The paperwork describing the overpayment and the demand for recovery of funds have all come fairly quickly, and I'm at a loss as to what to do because I don't know what's right and I can't follow it.
The Debt Management Center, located in St. Paul, Minnesota, denied our request for an on-camera interview and refused to answer our questions about how much these bills are generally for. They did tell us, however, that over the past 2 years, they've issued over 1.4 million overpayment notices. Lawyers specializing in veterans affairs explain that overpayment notices happen in a wide variety of situations.
It happened to me, and I'd gotten out of the Marine Corps in 1977 and had been paid a severance. Well, later on, when I got VA benefits, I had apparently not put on the document that I'd received this severance payment. Well, the VA says you can't receive both VA benefits and this military benefit for the period of time that the compensation was awarded. So they collected it back, and they can do that.
Agencies.
Attorney Sean Kendall said the overpayment problem is indicative of the bloated and inefficient bureaucracy across all branches of the Department of Veterans Affairs.
It's difficult because the taxpayers don't want to pay people benefits which they're not entitled to. But you would also expect as a taxpayer that the government would have a system so that people are not receiving benefits that they're not entitled to. And so in this case, if the VA system had been working, then this large overpayment would not have been created. I think part of the problem, though, is that the VA's culture and large bureaucracy is not adapted to really being touchy-feely with people. It really is a system that's designed to keep people at an arm's length. I mean, I think the policy of the Denver VA regional office and the Veterans Benefits Administration is to keep veterans at an arm's length, keep them out of their offices, and to not really provide information to them. So filing claims for benefits or has been consciously made by the government as difficult as possible.
As for Tom, he says he wishes he'd known more about the benefit system sooner, before his bill got so big.
Well, that's all for today's The Real USA. Don't forget, you can always send us your comments and your suggestions to our Twitter at teleSUR English. I'm Alexandra Hall. See you next time.